March is Colorectal Cancer Awareness Month, so we want to highlight the importance of screening for colorectal cancer and the importance of promoting a healthy lifestyle habit that can decrease a person's risk. So joining us is Dr. Matt Yurgelun, a medical oncologist who specializes in colorectal cancer at Dana-Farber Cancer Institute. Doctor, thank you so much for joining us. And we know March is officially recognized as Colorectal Cancer Awareness Month by the White House, the American Cancer Society, but there are some new statistics on the disease that are rather alarming. What's your initial impression about young people, and what are those numbers telling you?
So the numbers that we see from these newest data are really kind of reflecting, I think, what a lot of us are seeing in practice, which is that colorectal cancer has very much become a cancer of young adults in the same way that it has been a cancer of middle-aged and older adults. There's been a misperception now for some time that this is a cancer that only affects middle-aged and older people, but I think increasingly in our cancer clinics now we're seeing younger and younger individuals. It's not quite clear why, but these numbers certainly reflect what we've been seeing in practice, unfortunately.
Sure, and also, unfortunately, as you point out, there is more advanced disease, the younger a patient is when they get it, when they're diagnosed. So does this also mean that younger people are getting diagnosed after the cancer has spread?
Too often, unfortunately, yes. We're seeing our younger patients are disproportionately more likely to show up with cancer that has spread either to nearby lymph nodes or sometimes to other organs in the body, often in stages where it's not necessarily curable.
Why is that happening?
Well, we certainly will see that some young people are having symptoms longer than older people, symptoms that are sometimes chalked up to things like hemorrhoids if they're having blood in their stool or changes to their bowel habits, symptoms that are chalked up to benign causes, and people are not necessarily thinking to get a colonoscopy, not necessarily thinking that colorectal cancer could be an explanation for this because they're quote unquote too young to be getting this. These numbers are showing us that that's not the case. There's no such thing as too young.
Yeah, but there has been some change, especially when it comes to screening. So who should get tested?
So currently, national guidelines recommend colorectal cancer screening beginning at age 45 for people who have no risk factors for colorectal cancer. We're seeing that the rates of screening in those who are 45 to 50 are still, unfortunately, pretty disappointingly low. For people younger than age 45, though, if they have a family history of colorectal cancer, if they've got any of one of specific inherited syndromes, things like Lynch syndrome, sometimes people need to start colonoscopies as early as in their 20s. And then absolutely anybody who's having any concerning symptoms, things like blood in the stool, changes to the bowel habits, unexplained weight loss, a colonoscopy should be a strong consideration.
Sure. And let's talk about certain disparities among different groups, because that continues to be a problem. What would you like communities of color to know about colorectal cancer risk?
So what these newest data have shown us is that the risk of young onset colorectal cancer in particular, and colorectal cancer across the board, that risk, the burden is really being borne disproportionately by people of color, people who are underinsured, people of lower socioeconomic statuses. And so I think it's really important that we get the word out there that colorectal cancer screening really works. A lot of people say, well, hey, I'm not having any symptoms, I feel well, why would I do this? And that's the whole point. The whole point of the screening is to look for a problem before it causes symptoms. And by looking for it, finding it if it's there, and dealing with it before there's symptoms, we really have a much better chance of curing people.
Sure. Can I ask you one last question? Some people can be a little squeamish about the prep and then a colonoscopy, just the idea of it. And so there are other over-the-counter options. Do you recommend those, or do you think it's important to talk to your doctor before you decide what to do?
Certainly, it's important for anybody to talk to their doctor to figure out what's the right fit for them. Colonoscopy is probably the approach that's used the most widely, which does involve a prep and does involve an invasive procedure with some anesthesia. There are other approaches that can involve testing the stool directly to look for evidence of blood or other DNA factors that might be a tip-off that there's a cancer there. So colonoscopy is not the only way to screen for colorectal cancer. And definitely, if the prep or if the procedure itself is something that's really a barrier for people, it's worth looking into what some of these other options might be.
Excellent. All right, Dr. Matt Yurgelun, important information this month. We really appreciate it, and thank you so much.
Thank you.